Hey everyone, this is Dr. Lopez trying to make a quick video here again. The topic that I wanted to talk about is patients that may receive a bad adjustment or a bad experience with a chiropractor. Some have told me in my office that their last chiropractor it just didn't help them at all, or they had a bad experience with it. So I made this little chart here. According to the American Chiropractic Association, there are about 200 types of techniques, chiropractic techniques, that chiropractors use. This is just a list of a few of them that I wrote down. The most common one that we end up learning in school the first time is diversified. So it's a manual adjustment. That's when we actually use our hands to adjust either the person's neck or back or so on. Some chiropractors adjust extremities, some people don't, but I find most people do. Activator is a type of adjustment where it's a smaller instrument that is used to give a quick adjustment to your neck. We happen to, in this office, I happen to use diversified, activator, Thompson drop technique. So activator because it's not so aggressive, and people that have had osteoporosis, or maybe somebody that's just never been adjusted before, maybe they're a little bit scared, we end up using activator if we can adjust them manually. Thompson is the one that we use here because some patients that have had a bad experience, they say that when they're laying on their side and the doctor adjusts them, they feel sometimes like they're pinching on their ribs, so they actually end up with rib pain. So that's why we use Thompson drop in this office. Now there's a bunch of them here. Applied kinesiology is another one where it involves more addressing the muscles, and they state that muscles have some correlation with glands and organs. So that's kind of their philosophy. Cranial technique, I've had that done before, but I honestly don't remember how that felt. It's just it's been a long time. I've had that done when I was in college. The one I really like recently was ART technique, and that involves stretching and movement more so than the actual adjustment itself. They do adjust, but the actual movement of the muscle, stretching of the muscle and tendon is what they emphasize there. So I really like that technique. I had that done on me when I had my injury a few years ago. Gonstead technique is another one, and to be honest, I've had Gonstead technique adjustments done on my neck. They are good. I do like them, but I probably wouldn't recommend them on somebody that's never had a chiropractic adjustment before. They do emphasize taking a full spine x-ray where they can see the occiput all the way down to the sacrum. So that's something that they really require when it comes to getting treatment from them. So I guess the reason why I outline this is because you as patients, we don't expect you guys to know all these types of techniques. So if you come from a doctor that maybe was a Gonstead doctor and you move to Maple Grove or wherever, maybe that doctor that you meet may not have specialized in Gonstead, so you may not have the same experience as you did before. Okay, I want to talk about doctor or clinic philosophy. Throughout the country, you'll see clinics that call themselves Acme Family Chiropractic or Wellness centers. We're actually Lopez Health Center, but these types of clinics, they'll take anybody. They'll take kids, seniors. They'll take anybody that has a spine. So that'll be that's one type of clinic. Now, if you find yourself in a clinic that is an injury center, they're more likely to address any type of whiplash injury you've had, concussions. Not saying that they're a bad thing. It's just that they'll be able to diagnose you with concussions or maybe send you out to a neurologist, and so treat your symptom, for example, whiplash. If you are in an injury center, chances are they're probably not going to be talking too much about nutrition. They might, but some of the injury centers are just there to treat your symptoms, such as pain. Other clinics, they work on 90% of their treatment involves nutrition and diet. Now that also correlates here with family and wellness, but some chiropractors don't believe in supplements, or they're not likely to suggest supplements, right? Other chiropractors swear by it. I happen to like supplements myself, and so I do talk to patients about nutrition and diet and exercise. Okay. The last thing I wanted to cover is patients themselves. What is the reason why a patient would go and see a chiropractor? Did they get involved into a motor vehicle accident? Are they in pain? Do they have headaches? Do they have dizziness? Have they had a sports injury? Did they roll their ankle? If that's the case, we probably would want to go to an injury center, for example, to get these symptoms treated. Now, the wellness type of it, aspect of it is after you've gotten better, we want to address any proactive approaches that we want to do to keep you in a state of wellness, right? Or being healthy. Is the patient a marathon runner? Somebody that is preparing to run a marathon or half marathon in a couple of months, and they have ankle soreness. So that would be the type of thing to consider when you're a patient. What's the condition? So if we can find out what the condition is, we can pair them up to a doctor that might be able to help out in that sense. Finally, I wrote down, it's not you, it's me. Again, we don't expect the patient to know what type of treatment, what type of techniques that the doctor can perform. But it's up to us to be able to diagnose the patient, find out what their condition is, and see if we're a good fit for that patient. Not every patient is going to be an ideal patient, for example, for myself. If you have a child who suffers from colics, things like that, I know a doctor in Bloomington, Minnesota, that just treats children. And I made a conscientious effort a long time ago that I probably would not just want to treat just children. There's other chiropractors that treat dogs and horses. So if you have a pet that's limping a little bit, you can take your pet to an animal chiropractor. So there's a lot of different things to consider. But again, it's up to us as doctors to really get into, find out what's going on with the patient and see if it would be a good fit. So it's kind of like going to a beauty salon where you have 4 or 5 options, but maybe one person stands out a little more for yourself, where they're all cutting hair, but maybe one person has a technique that you might like a lot more. And same thing goes with mechanics and all different types of professions. So that's more up to us as doctors to be able to diagnose and see if this would be a good fit for you guys. So anyways, that's my video for today, and we'll see you guys next time.